I think under 11, Sheriff Hoxett wants to speak to you. It'd be new business. Well, oh, new business.
Old slash.
Yeah, oh, new, yeah.
Okay, a motion to approve the agenda.
That's all the changes.
Yes, ma'am.
Motion to approve.
All in favor? We have a motion to approve the minutes from the regular meeting on November 13th, 2023.
I'll make that motion.
All in favor? We've got director training April 30th through May 2nd, paid by grant.
Yes, we have, the Regional One Health Directors have a grant that's going to pay for all the health directors in Region One to go to this conference, and I just wanted to let y'all know and make sure it was okay that I go with them on this conference. They're doing the registration costs, the airfare, meals, hotel, everything.
Where's it gonna be held?
It's in New Orleans, and it's on the new public health laws.
Okay.
A lot of important people, they say, is going to be there.
Do we need to do anything for that?
Just,
Yeah, just
There's-
FYI, if y'all are okay with it.
no opposition.
Okay.
Or we need to do anything about that, or is that just an FYI?
That was just an FYI.
And we have advertising.
If we go back up to number 5, clinical services,
Oh, I just.
is that okay? That's okay.
No, I just completely skipped over.
No, that's
that.
okay. That's okay. I made a report here to let y'all know. In November, we had 353 patients that we saw. December, we had 302 patients that we saw. This is all in the new clinic portion. And then January, 363. And then dental services for November, we saw 151 patients. The hygienist saw 97. December, the dentist saw 122, and the hygienist 93. And in January, the dentist saw 176, and the hygienist, I left a number out. I want to say it was 68, but she was out 2 weeks with COVID. And then the next portions of your handout that I gave you is the monthly spreadsheet. And the total amount we billed for November was right at 96,000. December was right at 81,000. And then January, we billed out 85,000. So we have really picked up in our revenue stream since we've added the clinic.
How does that compare to like the previous year, if you know?
It's almost quadrupled.
Quadruple?
Almost, yeah.
That's good.
Yeah.
I'm glad to hear that.
Yeah.
You get an insurance thing now, right?
Yes, we do. And we're credentialed with all the insurances now except Medicare made us do a new NPI number, but they're going to retro it back. We don't know how many months they're going to retro back, but we had the same NPI billing numbers EMS. And they said for a primary care clinic, you couldn't have the same NPI. So they made us separate those.
They are going to allow you to bill some retroactive
Yes.
bills.
Yes.
You don't know, I mean.
We're not sure how long or how far they'll let us go back, but we're hoping at least 90 days, hopefully. Yeah. The next item is number 6 on the agenda. That is our Dogwood Health Trust grant that we got for our Community Linkage to Care grant. We're pushing that forward. They approved that they will let us push it forward till this coming July 1st because we had enough money from our other grants and we sure didn't want to lose it, so they're letting us push it ahead so we can use it. Number 7, advertising. We're fixing to advertise on some billboards around town about immunizations and COVID vaccines, trying to get our vaccination rates to come up higher. Number 8, our financials. I included a copy of our expenditure report in here for you. And with that being said, I have a budget amendment needed that we've laid. It's a one-sheet piece of paper, I think all y'all have. Stacy's out, so she didn't get to put it in the correct format. And it's just moving money from one line item to the next, but I've got it broke down. It's every bit going from COVID contracted services to the actual department we need it in. We need to move $23,000 to salaries under the COVID grant. We need to move $2,000 for the COVID FICA and $8,000 for COVID insurance. $3,000 for retirement. And then we need to move $25,000 from contracted services over to child health salaries. We need to move $3,000 to FICA and $1,500 to insurance, and that's under the child health.
What was that last thing again, though?
FICA was $3,000, insurance $1,500. And then the state has made it to where we have to do mandatory training this year. They've dropped all the COVID waivers. So we want to move $7,000 from contracted services into travel. And that's the general travel fund. That's going to be more than we need. But Megan Phillips has to go for a conference for a week at Raleigh. Sean has to go for a WIC conference and an immunization conference. So we do have several conferences that everybody has to attend. We would like to move $40,000 out of contracted services into adult health salaries. $10,000 from contracted services into medical supplies. And when I say medical supplies, that includes all of our, we're giving a lot of Solumedrol, we're giving Rocephin shots. That's including all of that medications that they're using in the clinic daily. We want to move $2,000 from contracted services to the food and lodging office. We've had to make a new office to separate food and lodging and the sanitation, environmental health specialist. And she's wanting a new desk and bookcases.
Who's in that office?
Her name is Jamie Paris.
Okay.
And she is finishing this week. She will complete her food and lodging training. Then she'll just like her on-site inspections, and she's going to be going to Macon County one day a week, and she's going to be going to Murphy one day a week and Swain County one day a week. So we're hoping to have her authorized doing our inspections for us and get away from all this money we're paying out. Yeah, contracted services. So we hope to have her done within 2 months. And that'll save us a lot of money. Contracted services, we would like to move from that to adult health, $3,000. They're needing some new filing cabinets, office supplies, and bookcases. And then from contracted services to environmental health supplies, $3,000. That's just going to get all the equipment they need. And hopefully we won't need near that amount, but that's just a flat amount we were going to move over. We thought we needed to move $170,000, but we actually just need to line item around $136,958.
And that's what you've just gone over.
Yes, ma'am. And when I came to work last year, the budget was already pre-made, and the previous health director had all of it left in the COVID settings. But our employees are they're working in other departments now. They're not coding it, and the state makes you code it correctly. So we're not actually coding it to COVID anymore. So it needs moved to where we're actually using it from. Adult
be-
health, child health, yes.
State requirement.
Yes, ma'am.
Do we need to wait until Stacy does the formal?
You can go ahead and approve it. You'll just sign it the next time she comes.
Do we have a motion to approve?
I'll make a motion to approve the transfer of those line items that Ms. Stevens has just gone over here.
Do we have a second?
We can't do that unless we have, amendment from the finance officer to do that. That's the law.
Okay.
Okay.
We
so-
have done it and then we ratify at the next meeting. You remember Becky would do it a lot.
It's not,
Okay.
So if you write it down, we'll rescind my motion.
it's just,
Yes, we certainly want to say,
the finance officer has to present it for it to be.
will that do you any harm?
No, that's fine.
Okay. so
Yeah, that's
hold
fine.
up any of
But she
your
does
actions.
know it.
Thank you, Lynn. So I've rescinded my motion
That's
until
fine.
we get them in front of us.
Okay. The next item on the list is 9, Board of Health Annual Training, and it's regulation that we present you with a manual, and that's what this one folder separately is that says Board of Health. That'll be your manual for you to keep. It includes a copy of operating procedures policy, community involvement policy, observing public health laws, rules, and regulations policy, workforce development policy, and delegation of authority. And none of those policies have changed, but we have to give you a copy of those yearly. The next item, number 10, is the fitness center update. I have been working with WNC Bridge Foundation, Sarah Copley, I think so she pronounces it, Copley, and she sent me actually this afternoon a breakdown of different grants that we will be able to apply for in addition to what we knew if we can get land dedicated for this fitness center. Cannon Foundation has already come and met with us, and they are committed to helping us get funded. Dogwood Health Trust is interested. Nanahala Foundation, we're hoping to approach them. Southwest Commission on Aging. And then she sent me today, Sarah did, North Carolina Department of Commerce. She said Golden Leaf, she spoke to them and they could help with public utilities, grading of the site, and remediation if we needed to do any for the environmental studies.
And you've already had an opportunity to meet with them one time,
Yes, ma'am.
the Golden Leaf.
Yes. And then the USDA Community Facilities Grant Program for North Carolina. Those are all ones that she has spoke to this week. So there's a lot of different foundations I didn't know about that we can inquire with grants for the property, if we can build a facility. Our main thing is to see if we can go ahead and get a designation for the property. We would like to have at least an acre, if we could, of that West Fort Hill property designated for the use of the fitness center.
Any discussion for the board? From the board? If not, I will make a motion that we designate an appropriate amount right now, like an acre of property, so that Director Stevens can move forward with applications for grants. And I believe not only will the grants be applicable for the building, but also the sustaining expenses
Yes,
of the facility once that it is in place.
that's our goal, to keep applying for grants yearly after we get the facility to help us maintain it and keep it running.
Do we have a second?
Second.
All in favor? Anybody other vote?
Good, thank you. We appreciate that, thank you.
Yeah.
The next item, 11, is for old and new business. Sheriff Hodgson.
Ma'am, yes, ma'am. Good evening, everybody. Last year, January the 10th, myself and Chief Deputy Cody George and Assistant District Attorney Jim Moore came and presented a presentation on the evidence at the office. After the presentation, we asked for, I think it was 20,000, something like that, in funds to hire somebody to do our evidence audit.
To hire someone
For an evidence audit.
Okay.
The sheriff's office never has.
evidence audit.
We started that audit, we thought the money was coming out of that special fund, wherever that special fund was. But through the year, we found out that it come out through our contract services, and it came out of our budget. We thought that that money was still being rolled over this year, and it was coming out of contracted services. I think we spent about close to $13,000 since we started on that one employee working. And Kim can probably tell me if I'm correct, it's only about $1,200 that's actually come from that pot of money that it was going to come from.
We've got a budget amendment. What they did is move the whole 110,000 when, out of the LATCF money. It all came out of that and went into sheriff budget. So it was like, it's big stand, 110,000.
So when we talked about it, Kim and Stacy said that we should have saw that and been able to ask for it to be moved into the next budget. After I've been talking with Stacy, she looked at it and said, no, you couldn't see what we had done and you didn't know what was going on. We thought our contract services last year we was just using that money. We didn't know that that payment was coming out of our contract service. So, this 74,510, 7420 was set up. We was unable to see that. But still most of that money come out of our contract services instead of that 510, 7420. So, my contract services were completed in those funds, and I'm just asking for the remaining money that was asked for and voted on, that we could have that money to spend on the evidence audit.
What do you want to do?
No, he doesn't work 40 hours a week. He doesn't work every day. He come in as contract services, and it has to be under a certain number of hours. So he's been abiding by the county rules and working so many hours a week. And it's actually worked out good this way because he can come in and work the DA and take time off, and that allows the DA to get called out for the paperwork that he's already done. So it's really worked out, him working part-time and just not needing to come in every day to work.
So Kim, since the money was already approved.
It was the evidence inventory and audit, 25,180 was dedicated to that pot of money at that time, is what was given to us.
It all went somewhere else. So what, do we need to just transfer it from where it went to where it should have gone? Is that what you're asking for, Sharon?
I guess Stacy needs to explain it, because it was my understanding that it was just in the general budget. So each year, unless it's in a specific account, the general budget just is extra money. That's your surplus. So what he's saying, he didn't get to use what was surplus in his budget. So that's something Stacy needs to bring to y'all. Because this would have been when Becky was still here. So it crossed to Stacy and then it didn't get crossed to Brad or Sheriff Hawks.
All right. So what would be the fix for?
You'll have to do a budget amendment, but you'll have to wait till Stacy gets back.
Okay. That's, all right. All right. You're
It will
welcome.
be for the full, is that correct? Right.
Let's see, we have spent, quite a bit of money out of our contract services. And so, yeah, I think it's less $1,200 or something like that. I think that's the only amount of money that we have spent that was awarded to us. Yes, sir.
So when we see that, the amendment come through, then,
Okay,
we can take care of it.
sounds right. Thank y'all for your time.
Y'all being real noisy. You're not everything I know, Cody. Thank you.
The next item was public comment.
I'd like to say something, I
Okay,
appreciate these numbers. This is something over the years that we have asked for. We've never seen
And thank
the
you.
number of people that's been seen.
Yeah.
And so, appreciate that.
you're welcome. And I did y'all a little printout of every department they're in because I think that's important for y'all to see.
Well, but I feel like we want to know what services are being provided
Yes,
for our people. It's extremely important.
yes, it is.
Difference to the number of patients the clinic is seeing. I mean, that's really filling a gap right now.
Yes. And a lot of them have multiple procedures when they're there. I mean, it's a lab, an immunization, or medication, so they're busy. I can tell you, we hop from the time we get there to we leave.
Well, that's really good. This is a lot of people served,
It is.
and I know there's more. I'm sure there's some you can't get to.
I wanted to ask a kind of stupid question. You're making money now. And that will support the health department, right?
Yes,
Which
ma'am.
means you'll be off the county shoulders, right?
That's our goal. We don't know how much Medicare will pay us of each claim. Medicaid pays us the Medicaid rate, of course. But we're starting to get quite a lot of money in now. So it's like, oh, thank goodness, money's starting to come in.
That's like,
Yes.
So you make a good point. Billing wasn't being done, I believe. No billing. You
the
were
certification was.
certified with.
They weren't
insurance
credentialed,
companies.
no, they weren't credentialed to do any of the billing, and now we are, and we're billing for every service we provide. Other than the state funded, let me make that clear.
And that is a help to the citizens.
Yes, it is.
It is.
And Dr. Amy Quang, she was there today for the first time seeing patients. And
how often
she's,
is she gonna be there?
she's going to be there till Megan gets back from maternity leave.
Okay.
And she's going to see patients like 2 days a month. And she said she might stay 1 day a month or two to see patients because she's, as far as I know, the only medical doctor that's seeing patients in our county right now.
Yeah.
The advisory board, any of you?
Pardon?
What?
She said, yeah. Oh.
Just one thought on that, you're talking about that fitness center.
Yes,
When the county was looking at putting a jail up there, I done a topographical survey and everything of that. So you've already got that to move forward.
That will help save a lot of money.
If you don't have it, hard, y'all send it, I will need to.
Okay, thank you very much.
Well, that was something important.
Yes.
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 Maybe so.
Well, the whole board's important. Thank you all, each of you on the advisory board. Appreciate you coming.
Wanted to see things moving forward.
It's exciting to think of a fitness center that will be near our senior citizens building, and I had a very wise person point out to me if we had any medical occurrences of folks who might be accessing the fitness center, the ambulance is just right across the road.
That's correct.
Very close. Yes.
On a positive note for the mental health side of things, I have been trained to do first aid mental health, youth first aid mental health, and I am going to be training, large number of the high school teachers on February 27th. I don't know how many yet. It's all the teachers who are not, getting the SAT. So all those teachers will be, doing youth mental first aid that day.
Good. That's very,
So that is coming down from DHS. They're getting ready to start making that across the board, like all teachers have to have it. It's normally very expensive. And we're running under a little special program right now where it's free.
that's wonderful.
Where are you holding the training?
It'll be at the school.
At the school.
And we just learned this month that DHHS is going to start investing money into health departments starting year 25, 24, 25 for mental health and behavioral health. So they're going to start putting money into the health department where like our community linkage of care has had no funding from the state before. So they are going to start sending money down to every health department, we were told, to help with that. No, we don't know how much.
That's one of the biggest needs across the board, across the country, and certainly in our,
That's all I have.
We have. We have a motion to adjourn.
Wait that motion.
So long, somebody put it up.
I've never seen your student. Second.
You don't do it.